2020 order suspending certain
This conference will now be recorded.
All right, go ahead.
of the open meeting law, GI, Chapter 30A, Section 20, and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Harwich Board of Health is being conducted via remote participation. No in-person attendance of members of the public is permitted, but every effort will be made to ensure the public can adequately access the meetings as provided for in the order. And I now call the meeting to order. Present Sharon.
Yes.
And Ron.
Yes.
And Anthony.
Matt.
Matt, oh, here I go again. I have to get my act together here. And Matt, except you're all present, thank you. You want to, the meetings at the last minute of the last meeting, do I hear a motion to any questions or changes?
No, I don't have any.
Okay, do I hear a motion to have this meeting minutes pass?
I make a motion. Go ahead.
Okay, go ahead, Sharon. Go ahead, Sharon.
Go ahead. I'll second it.
Okay.
Okay.
Ron first and Sharon seconded. Matt, are you in favor?
Yep.
Okay, and I am in favor, so the minutes of the previous meeting have passed. Okay.
So there are actually two sets of minutes that have to be approved. So if you want to do a motion for the other set, that would be great, please.
I'll make a motion for the other set also.
I'll second it.
Okay, so Ron has made a motion and Sharon has seconded. Matt, are you in agreement?
Yes.
Okay, and I am in agreement, so pass also. Okay.
Okay, so we can now start the Board of Health work session. And the first item on the agenda is the COVID-19 update. And I can start by giving you the case numbers from Harwich. And right now we are staying steady at 121 with 23 deaths in town. And 71 out of the 121 are associated with the Wingate residents or staff, leaving 50 cases that are outside of the Wingate. And of those 50 cases, 43 of them have recovered. So we have a good recovery rate right now with only 3 active cases in town, and all 3 of those cases live in the same house. So there's one house in town.
Where's that house? Where's that house?
I can't tell you that information. But I can tell you that the original positive in that household is a healthcare worker. So that again kind of shows where the source of the infection came from, and unfortunately passed it along to the family members. In the Commonwealth, we are seeing very slow rise again in numbers. So very small new case numbers day by day. We were in the thousands each day for many weeks. And the past few weeks, we've been less than 1,000, less than 500. And currently we have 105,885 cases in Massachusetts and 7,665 deaths. Barnstable County is slowly increasing as well, but again, the numbers are are smaller each day than they have been in the weeks past, with 1,494 cases in the county and 131 deaths. So that's where the numbers are right now. Does anybody have any questions about cases or the statewide manifestation of COVID?
Is the average age still 82?
The average age of fatality is still 82, yes. The average age of people contracting it is 52. So most people who get it, the majority of the cases that are positive are in the 50s, but the ones that are in the 80s are the ones who die from it or from complications of it.
Now, the 50s, are those mostly healthcare workers?
They don't break it down to that level, but they do break it down to number of positives that are associated with long-term care facilities, which is both staff as well as patients. So it does exclude hospital workers or EMS staff or home care workers, but the dashboard does tell us that just over 22,000 of the positives are associated with long-term care or healthcare workers within long care.
Okay. Sure.
Matt, did you have a question?
I guess it's more like a statement. So your numbers are going down. So you think that it's a positive trend that we have now?
That's right. The things that we look for in trends are the number of positives versus your total number of tests done. So your percentage of tests that are positive, that percentage is going down day by day, week by week. And then the number of cases that are in the hospital, and that number is down week by week. Number of patients that are in the ICU, that number is going down. Number of available hospital beds is either remaining the same or going up, which is a good trend as well. So that's what we're looking for. We know COVID is in the communities and it's not going away anytime soon, but we want to see that those hospitalization rates and the fatality rates are continuing to go down.
Later on.
Any other? Yeah.
Something else in your packet down, I think if you're all on the electronic packet, it's around page 13. It's called the COVID-19 Control Plan. I think I talked about this last month when it first came out. Part of the reopening plan for Massachusetts is that all businesses must develop a written control plan for its workplace and how that workplace is going to be complying with the mandatory safety standards. And the town is a business and must also comply, but every business in Massachusetts also must comply with these standards. And the template it's basically a checklist of self-certification that they've provided training or signage or plans for social distancing and hand hygiene and staffing and cleaning. And there's a page, I think I can share my screen so we can see it all together. Yes. Okay. So this is all part of that mandatory safety standards, and these posters have to be displayed within businesses to let employees and visitors know that they have come up with a plan and are notifying workers that they have to wear face coverings and they have to stay 6 feet away from other people. They have to provide hand washing and hand sanitizing, and that they regularly clean high touch areas, and they have to provide some kind of training to the staff on social distancing and hand hygiene protocols. And then the cleaning section states that every workplace has to be cleaned and disinfected daily, if not more often, depending on what their business is. So this poster here has to be posted at all workplaces that you're seeing. And then between myself and Katie, my assistant, we developed this mandatory training manual that goes step by step through all of the mandatory standards for social distancing and washing, hand sanitizing, and staffing plan for what to do if you're sick, what to do if you're positive, what the business owner needs to do if a patient or employee is positive. And then cleaning and disinfecting. So I don't know if you've had a chance to read through it and if you have any questions, but I'm happy to answer anything, or we can go through it if you'd rather. You let me know what your pleasure is there.
Hi, this is Sharon.
Hi.
Hi. Okay, I only have one comment. Under the section of hand washing, one thing they don't include is turning spigots off and on. When you turn them off with a paper towel. That's kind of a standard thing. If you're going to have a dirty spigot and you're going to touch it to turn it on and you wash your hands, you don't want to touch it when you turn it off. So they usually tell you to paper towel to dry your hands and then use that to turn your spigot off.
Okay, so we can add that as part of step 5 there, where dry your hands using a clean paper towel and
using that to turn off the,
and then use to turn off the spigot. Okay.
Yeah.
We can add that.
Other than that, I thought it looked very good.
Okay.
Oh, there was one other one that I took note of. In the office areas, pens and pencils probably should be, you either use your own pen and pencil or they should be wiped between people.
Okay. So let's see where we can put that.
I forget where I was actually. Somebody had me sign up. Oh, at the at New England landscaping, and they gave me a pen, pencil or pen to sign, and then they wipe them off. Oh.
Okay, so we could add that to somewhere around page 7, where it's clean and disinfect, and
yeah,
we can add that.
You had some office something.
Yeah, you're right. There is something about like staying in your own office space, and
yes, around there.
So much easier to do this in real paper sometimes.
Yes, it is.
I don't know when you're saying about drying your hands. It says a clean towel. I think it should say paper towel.
Yeah, it could say a paper towel.
Paper towel. All right, we'll add that. And yeah, I know there's a part about, it says don't share.
It's something, yeah, I did read it. I just don't know where. Nice.
I think it might have been in the social distancing part, the first part.
That could be too.
Well, in any case, yeah, we in the town has implemented the following to assist. So we've put in plexiglass where prohibiting handshaking, and then where work areas are designated to limit movement throughout the building. So we'll add in there on page 5
Yes, all right, I see it, yeah. You need to have your own pens and
Yeah.
pencils.
Not sharing writing implements.
Very good. That's nice. That's part of it.
So I'm planning on doing a go-to meeting kind of like this, going through all of these pages of the training manual, doing a video, not really having a live audience, but doing a video to go through the manual and have it mandatory for all employees in the town to watch as part of our own COVID certification plan. And I have also offered to provide this plan to other businesses if they need a starting point. So I am going to stop sharing my screen now. Okay. Any questions, comments about the training manual?
Nice job. It's done very quickly.
Thanks. Katie put the bones together, and then I kind of formatted it and changed a few things, added a few things, but I think it came out okay.
It did. It was nice. Thank you for the work.
Other COVID updates. Town hall. In order to meet these mandatory safety standards, all town buildings have to have the proper signage and hand sanitizer available, as well as for office buildings all across the state. There's a 25% maximum occupancy for office buildings. So we've been trying to reconfigure office spaces to figure out how we're going to adhere to that. And it means that some office mates might not be able to be office mates for the duration of this pandemic. And it might mean that people either work remotely or they get relocated to a different office where they can work in a town building with a town computer, but it just might not be in their normal workspace. So that's been happening. Town hall is pretty close to being able to have all the signage and social distance like we can. That the 25% occupancy also applies to the public. So when we do open our doors to visitors again, we do need to restrict it to a maximum of 8 people. That's outside the meeting rooms. So the meeting rooms have their own occupancy, and meetings can go on at the same time as the building is occupied by staff. But we're only able to accommodate eight non-staff members at a time. And we've proposed to kind of police that by having people call for appointments so we know who's coming and going, and not just have someone counting people as they come through the door. I think.
What about getting a buzzer or something, like the school has?
Yeah, that's a good idea. That's a really good idea. That would help with a lot of things, deliveries and mail and everybody who doesn't have a key. So I'll suggest that. That's a good idea. I don't know how much those cost, but we'll see about.
Well, if we think it's going to be a while, it might be worth it,
Yeah.
For less headaches for anybody inside the building.
Right. Kind of like an apartment building where you buzz it and it opens the door. Yeah.
So you have a speaker and they say, "Who are you?" before they let.
We'll let you in. So this, we've gone through the harbor and they've been able to open because they have signage and social distancing in place. Golf has gotten the all clear from the governor's office to offer driving range, and the restaurant on site can offer outdoor seating. The golf carts can be used again. they are limiting contact between people for non-contact payments, and we still have not opened that pro shop yet, even though it's a retail business and technically could be open, because we do need to install a plexiglass shield there and a couple of other social distance signs. But soon I think the golf clubhouse will be able to open. The cultural center, we are waiting on signs and janitor service over there to make sure it can get cleaned daily, and the tenants in there can access their units once that happens. We just need to make sure that there's proper signage and a janitor there to clean the high-touch surfaces every day. The community center, the Council on Aging side is still, all the staff is there and they're operating in person and remotely as much as they can. They're still offering meal delivery for the seniors, and they're still doing public outreach for their senior citizens. As soon as that building is able to be open to the public, they can again resume those one-on-one council sessions that they do for signing people up for WIC or signing them up for SNAP benefits or anything like that. Social Security, I know they have a special room just to do that. So once the building gets the all clear to open, which should be within the next week or two, they can then resume that service. But they still can't have any indoor gatherings or any classes or get-togethers. They had like knitting clubs and sewing clubs and things like that, and those are still prohibited for indoors. They aren't prohibited for kids programs. So if you're under 18 and you're in a group of less than 10, you can go inside and get together at the rec if the rec chooses to run a program like that. And right now they have put that on hold because of all of the restrictions. So they don't believe they can accommodate as many kids as they need to. So they may just not run the program at all. What other buildings do we have?
What about the treasure chest?
The treasure chest, that is sort of like a yard sale.
Yeah.
I don't know if it's a staffing issue or just a desire to keep it closed for some reason. The leaving of things and having people too close together there, that's the problem.
Yeah.
But that's another thing that we have to deal with, yeah.
I'm sorry, the library, what were you going to say?
The library is now open for curbside pickup. Ginny Hewitt is the library director, and she developed a very nice, comprehensive curbside pickup plan. And they're not able to open to the public yet per the governor's orders, but once they do, we still need signs and plexiglass set up there. We have it, we just need to install it. And the other problem again is the custodians. Right now they can't open on Saturdays because we don't have a custodian to clean the building. Excuse me. And then we have the DPW and police and fire buildings that didn't really get a whole lot of public traffic anyway. You don't need a whole lot of retrofits because they're either police and fire are exempt from needing to meet that 25%. And then DPW, I believe most people have their own offices there anyway, except for the garage area. Anybody else have COVID questions or updates or?
Is the gym going to be closed for a while?
Mm-hmm. Yes. Gyms aren't allowed until phase 3. So right now,
okay.
Phase 2, step 1.
Okay.
So gyms will be allowed in phase 3.
Okay.
I didn't notice any signs at Stop and Shop saying a face mask was required when you go in.
Oh,
I
okay.
think that, I'm surprised, usually they're right on that.
I went specifically to find one, and I couldn't find it.
Yeah.
Okay.
Maybe it fell down.
Well, there should be more than one, so we'll give them the benefit of the doubt, but I'll send someone over there. We get tons of complaints, and I think if Jen could nod her head to in agreement, we get probably 50 emails or phone calls a day just on, is that about right? Yeah, okay. 50 emails or phone calls, just COVID related complaints. And they're people not wearing masks in restaurants or on the sidewalk, or stores not prohibiting people from being there without a mask. We recently opened up restaurants to outdoor dining, so we've now we're getting a new set of complaints about restaurants not making their guests social distance. So I am going to propose an extra staff member, and I know at the Board of Selectmen's meeting last night, the selectmen said that they would entertain the thought of additional staff, not knowing whether or not it would be approved or not. But temporarily, I think temporarily it would be covered under the CARES Act, but we are just overwhelmed with COVID stuff that I can't even catch up. So I think having an extra staff member to handle complaints, or COVID complaints anyways, would be very helpful. The last COVID kind of thing I wanted to bring up was yesterday I met with Outer Cape Health Services, with police, fire, assistant, interim town administrator, harbor master, DPW director, as well as the town engineer. Outer Cape Health Services has been selected as a pop-up testing site for COVID-19 in response to the mass gatherings that have taken place over the last several weeks. So the governor's office announced 50 pop-up sites across the state, and Outer Cape Health was selected as one of those sites. And this clinic is happening on Wednesday and Thursday this week, as in tomorrow and the next day. They have ordered 1,500 tests for their 3 sites. So Outer Cape has Harwich, Wellfleet, and Provincetown, and they have ordered 1,500 test kits from Quest Diagnostics, and they plan on doing about 500 per site. It was originally thought to be pre-registrations encouraged, but walk-ups or drive-ins are okay. After the announcement went out yesterday through Governor Baker's office, they were overwhelmed with phone calls and quickly realized that appointments would be quite beneficial. So they started taking appointment times, and now they are nearly full on both days, Wednesday and Thursday. They still have some capacity for additional testing, but they are busy, which is a good thing. I offered health department resources, and the town has offered the Saquatucket Harbor parking lot as kind of a staging area for traffic flow, because we think we're going to have a few hundred cars throughout the day, and we don't want to block up Route 28. So I will be there tomorrow, as well as Katie and police and fire, and the harbor master will be around. We're getting a few police details to help with traffic. If anyone's listening that's going to the clinic, the entrance to the clinic is actually the harbor parking lot. The upper They call it the lower lot, even though I feel like it's the upper lot. The northeast entrance, the new lot is the entrance to the testing center, and you'll be wound around the parking lot and wait for the traffic to allow you across the street to the testing center. So we don't overwhelm the clinic, because Outer Cape Health Services is actually still open for business that day. So they are already expecting 100 patients, and then putting a couple hundred more cars on the site was going to be tough. So we have developed a pretty good traffic plan. We have CERT volunteers and MRC volunteers that are helping with traffic flow and management of registrations and things like that. Any questions or comments on the testing center?
I have a question. Has the state made any contingency plans if you end up getting more requests for testing than time slots are allowed?
I think Larry may be able to comment on that, only because you were on the call with Outer Cape today.
I know, thank you, Megan. My understanding is Pat Nagel this morning, part of her call, suggested they might be able to add one other staff person to increase their capacity, maybe 25, 30% for the short days. Their second comment was, if they're overwhelmed on Wednesday and Thursday, would the state or should everyone consider a couple days next week to catch up? And so I'm not sure how excited I am about that, because it's all the other blocking traffic and stuff. But it's, I think, as Megan, you said, I don't think you were Outer Cape Health, but the state seemed to be surprised by the number of people that signed up for it. And I don't know how they're going to shut this off if they got people standing in line. So that's, I know. So everything's in limbo. They were asking some questions, but nothing coming back.
Yes, when we learned about this, I thought that they had 1,500 tests just for this site. And then today I learned that it was 1,500 tests for the 3 sites. So I am sure we will be overwhelmed and with a request for testing. People want tested. So hopefully they'll allow a 3rd day or even a couple days next week, but we'll pursue it.
Just an overall comment, I know last night was mentioned, but this morning again, just how great a job Megan, the police chief, everyone involved with the town. I mean, can you imagine doing this on a couple hours notice and getting everyone together, a complex traffic pattern, and putting it in place? So they were, they appreciate it, but actually I think they were sounded too. I think our response was, well, that's what we expect.
Right, and every health department on Cape Cod has planned for a mass vaccination clinic at some point. So this is sort of old hat for most health departments, and a little different with a drive-through, but we had to change our site, so we adapted our plan to fit the Outer Cape site, and I think it'll work as well as it can with the site constraints we have.
Yeah, I have to think the years that we had the flu clinic, I mean, it's dropped down now with 3 clinics everywhere, but the flu clinic community center, Megan, must have laid a good groundwork for learning what's going on.
Yes, we would push 1,000 people through in just about 4 hours, so we're used to the high throughputs, and 200 in a day is easy peasy, I think. Anything else for COVID? All right. The next thing in the work session is item B, the VNA Town of Harwich contract for FY 2021. The VNA contract is renewable every July with a contract, and it is for $4,000. and it is used for things like communicable disease surveillance, maternal and child health services. Those are those visits for new moms, follow-up visits if needed. They do all of our communicable disease surveillance and follow-up for TB, foodborne illness, community case management. They also are able to do wellness and immunization clinics for kids and adults if we choose to hire them to do that.
Are they helping in any way with with anything with COVID?
They are. So they're our contract nursing service for surveillance. So they are billing us separately for COVID expenses because they're covered under some federal funding and federal and state funding. So this contract that you're looking at to vote and approve tonight would cover any non-emergency or any non-public health emergency surveillance or health promotion that we would need. That in the $4,000 budget. The COVID related, they've been putting in quite a few hours, and up to date right now, I think our complete VNA bill is just under $10,000 for the last three months, and thankfully that is covered by state and federal money.
That's good.
Yeah.
Okay.
So we just need a vote to approve the contract and provide it to the selectmen for their review and approval.
Okay, here I am talking, but I'm muted, so you didn't hear me.
Oh, geez, you think I'm talking over you.
No. So do I hear a motion to renew the VNA contract?
Yes, make a motion to renew it.
Matt, okay, a second?
I'll second it.
Okay, Ron and Sharon, are you in agreement?
Yes.
Okay, and I'm in agreement, so it has unanimously passed.
Okay, great. And we can move into old unfinished business. The hearing for Delori Murnane of 113 Brooks Road to consider a variance request to upgrade a Title V septic system by Moran Engineering Associates. They have requested another continuance to the July meeting. So you would need to make a motion to approve that continuance request.
Do I hear a motion for the request?
I'll make a motion to continue.
Okay, Ron, second.
I'll second it.
Okay, Matt, Sharon, are you in agreement?
Yes.
Okay, and I'm in agreement, so the motions pass unanimously.
Okay, then moving on to new business, we have an application for extension of sampling variance for Massachusetts Tier 3 beach. Zilpha Beach is a public beach, and they are eligible for a sampling variance extension. To give you some background, the Department of Public Health requires that public and semi-public beaches be tested weekly for bacteria, for water quality, and beaches that have had no failures over the last 4 years are able to apply for an extension of sampling to allow for monthly sampling instead of weekly sampling. So we would need a motion and a vote on that.
What was the beach that you're talking about?
Zilpha Beach, it's at the end of Zilpha Road. It is down near off of Lower County Road.
Up a Lower County. Whereabouts again?
Let me pull it up on Harwich report. All right, let me share my screen again. Are you able to see the screen, Ron?
No, I can't. I'm on my phone.
Oh, okay. But looking here, it's between Windermere Bluffs Road and Ocean Ave. So kind of it's in the campground area.
Campground area. Okay, that's fine. Okay. And what do they want to do?
The town is requesting a variance to sample monthly instead of weekly at that location. Sample.
Why would they do that? Why wouldn't they test weekly?
Because over the last 4 to 6 years, we have not had any failures there. And we've done a sanitary survey to show that there aren't any changes that would show that possibly the water quality would change. We do pay the county to run these tests, so it would be a financial strain if we didn't do it monthly instead of weekly.
I just have a question on some of the results. It just seems like the average sample result and even the highest sample result seem to be very variable. They seem to be, we go from the highest sample is 90 and the lowest is less than 2. It just seems like there's an awful variance in these. So what are the thoughts on that? Even the averages are like from 1 to 23.
I would guess it's because of tides or bather load. The sampler, this year we have a sampler coming out on Fridays, and they do all the beaches at the same time every week. So they may get it on an outgoing tide or an incoming tide, or seaweed or bather load.
How much does it cost to do it weekly rather than monthly?
Each test, I believe, costs around $30.
So for the summertime, you're talking what? So if you did it monthly, you're talking what? 120 and 120, you're talking 240 rather than monthly. So I don't know. It would seem to me if all the other beaches are being tested weekly, why wouldn't they test that one weekly?
Well, all the other beaches aren't getting tested weekly. The majority of our beaches already have a variance, but these variances only last 3 years before they have to be renewed.
Okay, I see.
So I would say I think we have 26 beaches about that we test. At least 15 of them are only tested monthly, and the others are tested weekly. They're just not different variance schedules.
Yeah. Which beaches are tested weekly?
I don't have that information in front of me.
Okay. I would think you'd want to test like Bank Street, Pleasant Street Beach, the lakes. I would think those where most people go would be. Are they tested weekly?
Like I said, I don't know which beaches are which without having the spreadsheet in front of me.
Okay, all right.
Just one other quick question. And I don't remember this in the training, but I thought there was something in there that when testing like that was done, that they would have to list whether it was high tide, low tide, certain parameters that I would think would not even out, but I'm trying to think of the word I want to use there. In other words, explain the difference more or less between why you would have the average sample of 1 versus 23. There's some sort of, I can't come up with the term I want, but kind of explain why you would have that kind of difference.
Mm-hmm.
So do you think that's
The sampling form does have that information on it, those parameters,
All right.
the temperature of the water, the time it was taken.
So looking at these results, do they look acceptable to you as far as when you look at the average and you look at the highest sample result, like I said, which is less than 2 versus 90? Does that make sense to you? In other words, do you feel that it's safe to go to monthly?
I do think it's safe to go to monthly, mostly because anytime a tidal beach fails one day, it almost always passes the next day, and the beach regulations don't have you close the beach the first time it fails. It needs to fail 2 days in a row. So testing more frequently. Our waters are just so clean that I feel that it's safe to go monthly.
All right.
Any other questions? Do I hear a motion to extend the sampling variance for Zilpha Beach?
Make a motion.
Okay, Matt. Second?
I'll second it.
Okay, Sharon, second. Ron, are you in favor?
Sure, go ahead. Yeah.
Okay, and I'm in favor. We're all in favor, and it passes.
Okay. Yeah. I have just a comment. Maybe when we get back into meeting in person, Megan could go through all this the beach stuff with me, because I'm kind of, I thought we were testing every week to make sure there was no problems and stuff like this. I didn't realize we were doing monthly, especially in the summertime.
Sure, we can have that on for next month's meeting so we don't lose track of it.
Just so that we have a rule and regulation, because again, I just assumed, I didn't realize we were doing it just monthly.
We only test the water during the bathing beach season, so it only
so that would be
starts in,
so we do it. That would be June, July, and August.
Right.
Okay. All right.
Right.
And just so would it be like the 1st of July or the 1st of August, or what date did they go and do it?
They'll do it the first time they sampled. So this beach was sampled. It's been sampled already because we got this notice late because of all of the other COVID stuff. So it's been sampled each Friday in June.
Each Friday in
June. 2 weeks. So once we get the variance approval up to the state, it'll get recorded, and then they'll go 4 weeks from the last time they sampled.
Okay.
So we can put that on for next month, so we can look at all the data and which.
Well, I was just wondering, my thinking was because of all the seals and all this other thing, I wonder if we, in other words, are we going to end up with some problems in the future because of this stuff like that? That was part of my thinking.
No, that's very reasonable. So did we do a vote? Oh, lost track.
Yeah, we already voted on it.
You voted on it, okay. Okay, so the next thing on the agenda is the report of the health director. My May report was all COVID all the time. We just recently went into phase 2 of the 4-step phase of reopening. And in this phase, we are allowing outdoor dining for restaurants, and there are still some restrictions there for outdoor dining. no more than 6 people to a table, and each table needs to be 6 feet apart from the next. Other restrictions include bars need to remain closed for bar service. Some bars have chosen to convert to table seating, so they're served by a waiter or waitress, and there's no bartender behind the bar. So I have seen some bars that there's no bartender behind the bar, but there are people sitting at the bar 6 feet apart from each other, and that is okay. Entertainment is not allowed at outdoor restaurants right now. Any sort of live performance, whether that's a band or a comedian or a trivia person, it's not allowed in this phase. And I've been doing a COVID update weekly with the Board of Selectmen to keep them up to date on our case numbers and the reopening plans that come down from the governor's office. Any questions or comments? No? Okay. Then the last part of your meeting tonight is the permits. Vote to review and approve the permits. We have some swimming pools. Those are part of phase 2 and allowed to open with restrictions. Bathing beaches are allowed to be open with social distance restrictions, and food service. We have all renewals, nothing new. We have a funeral director renewal and one motel renewal. And motels are part of phase 2, where they're able to open for leisure bookings instead of just bookings for essential workers.
I have a question on these.
Sure.
So we would vote to go ahead with the permits. But when I see here the number of seats, do we need to put something in these permits that would state, in other words, so they don't come back and say, oh, well, we're allowed 31 to 60 seats, when in fact, as a result of COVID, things are going to change. So do we have to put like some sort of a statement in there or clarify that they can't really have 31 to 60 seats or greater than 150, or do we have to specify that?
I don't think you do, only because any restaurant that has proposed outdoor seating has provided a plan that shows the number of seats, and none of them have exceeded the number of seats that their permit allows or their septic allows. The only restriction would be their physical location not able to provide more seats. So say, who's on our list right now, for example?
You want to say when we get into indoor seating, where you're going to have to limit the amount.
Well, the governor's orders supersede any local order.
Right. In here stating that, you know, we're voting on these, but, you know, that as a result of COVID, there may be further restrictions applied to that. I don't know. I'm just, you know, somebody can go back and say, well, you signed the permit saying I can have this.
Megan, if I can help on that, that was a discussion we had last night. You probably when we were approving entertainment and restaurant licenses. And I think our conclusion was that we approved the application that's presented because that's an annual application, and then we thought we would attach a memo that you're talking about to the governor's directions, what they have to do for phase, you know, currently. But the license itself is standalone. So assuming it kind of follows that same same format. That's it.
Any other questions? Do I hear a motion to pass the permits listed?
Make a motion to pass the permits.
I'll second it.
Okay, Ron, Sharon, do you agree?
Yes, but I would like to see a memo attached to it.
Okay. Do you agree with the memo, Megan?
Sure. Every licensed establishment has received several emails about COVID-19 restrictions. And if they're able to fit what they are approved for, then they can fit what they're approved for. We can certainly send every licensed establishment another memo saying they must comply with COVID-19 requirements.
I would think it just attach it to the license or the permit itself as opposed to just another. Because I'm thinking, they talk about a 25% occupancy. If they say it that in order to maintain the 6 feet distancing and whatever number of people. I just think it maybe be a smart thing to do to cover us, so to speak.
Jen, did you have a question? Oh, okay. I mean, I don't think it would hurt.
So are they going to attach some sort of a memo to the whatever that they would?
My only point is that we decided that in our case, the licenses were a standalone because they're annual. And then we depended on the governor's directions and what Megan's directions and others to supersede our annual. But if we started trying mixing up the two, our license is what our current COVID direction is. We're going to run around in circles forever. So we decided to be sure we kept the discussion separate. That's my only point. How you inform them is up to obviously you guys.
All right.
So where do we stand?
Fine.
So, does anybody check on the restaurants? Do we have anybody checking anything like that?
Right now we're working on routine inspections. So yes, we do have an inspector going out to do routine kitchen inspections, and they observe their social distancing and outdoor seating areas. We have reviewed all of the written plans for outdoor dining, and we'll do something similar once indoor dining is allowed. And we are working on a complaint basis for other inspections. So if we receive a complaint about overcrowding or restaurants having too many seats, then we would respond. But we have limited staff to go to every restaurant every day, and honestly, every day there's new rules. So we do. We have eyes and ears from all the other establishments. They're not shy about tattling on each other. So if someone's not playing by the rules, we usually know about it pretty quickly.
Yeah, well, that's only fair. That's good.
Okay, I still don't know where we stand with the permits. Sharon?
Yes.
Do you want the a memo attached?
I'll leave that up to Megan. I just thought it was a good idea to maybe say something to the effect that, that the governor's regulations will supersede what this is. But I guess if the Board of Selectmen aren't doing it with the other stuff, we don't need to do it.
Everybody okay with that? So do I hear a yes from you, Sharon?
Yes. Yes.
Okay, and I say yes, so permits have passed.
Okay. I see that there's a caller on the line with a DJ as their name. Could you identify yourself? Caller DJ, is that someone who wants to make a comment or speak to the Board of Health?
Emails like djjizzo@me.com.
It's, well, I don't know. Anyway, moving on through the agenda, we don't have any other agenda items. So if you want to discuss anything else, we can, that's related to this meeting, or we can adjourn.
I think we should adjourn.
Well, I did want to bring up about, I was hoping that maybe we could have a work group session on the role of the board and the role of the director, and how that regulations goes through the process throughout the town for people, and a refresher course also for me would be wonderful. Is that something we could do?
Sure. We can see what the agenda in July looks like, or we can have a separate work session just dedicated to that.
I think a separate work session would be appropriate.
Okay. Do you have a date or time in mind? Let me get the calendar.
No, I have to get back to you with that. I'm sorry.
Okay. I'll need about a week to get some stuff for you.
Oh, no, yeah,
to
doesn't have to be
review.
a rush. Just at some point, yeah.
Okay. Well, if you want to look at your calendar, Pam, and come up with a date, say the first or second week in July.
I think I'm off a week. I think it's the 3rd, but I'll look tomorrow and
Okay.
let you know.
Okay,
Yeah.
and then we'll see what the other board members' availability is, and we'll set up a work session.
Okay. Is there any time with any of you guys that you can't do it, a stretch of time in the next 6 weeks or so?
No, I'm fine. As long as it's the beginning of the week, like say Monday or Tuesday or something like this. Thursday seems to be a big meeting day for me, so a lot of times I can't make it on a Thursday.
Okay.
I'm an instructor on Thursdays and Sundays at the fire department, so I can't do anything on Thursday evenings or Sundays.
Okay, so if Thursdays are out. What about Sharon, you?
Oh, wait, I'm just checking something. All right. We may attempt leaving somewhere around July 22nd and try to drive out to Colorado.
Okay, that's my birthday. I'll remember that.
But I want to sleep in rest stops. I don't want to go into any motels.
That's
Thanks for
okay.
thanks for letting me listen in. I'm going to leave you all. I'll let you.
Okay. Thank you. Bye, Larry. So I'll let you know tomorrow, Megan, okay?
Okay, sounds good. Yeah, tomorrow you can email or text or call, and we'll figure out a day.
Okay, sounds good. Okay, a motion to adjourn.
I'll make a motion to adjourn.
Second. Okay, Sharon, you in agreement? Oh, that was Matt. and Ron seconding it, and Sharon's in agreement, and I'm in agreement, and the meeting's adjourned.